All right, guys, welcome to this administrative safety meeting. Can we go ahead and introduce ourselves? I'm Deambra, I'm the hospital administrator.
I'm Casey, the nurse.
I'm Garrett, the PA.
I'm Kelsey, the social worker.
And I'm Kate, the speech pathologist.
All right, well, thank you all for being here. Today we're going to talk about a medical error that happened with Jackson. He was a 5-year-old male who went to the ER for an acute asthma exacerbation and was given the wrong dose of magnesium. After that, he had a decline in his mental status and blood pressure and heart rate. Luckily, we recovered him, but we need to figure out what happened here so that we can prevent this from happening in the future. So from an administrative standpoint, there was definitely a systematic medical error that occurred. The pediatric ER wing was under construction due to flooding at this time, and so the PEDS supplies were only moved to certain bays of the adult wing of the ER. So in order to combat this, we would like to place PEDS supplies outside of every room of the ER, and we're also going to do a better job as administration of consulting ER staff when making decisions about placement of supplies such as this, especially during abnormal situations like that. The other thing that occurred was the wrong dose of magnesium was given. The pharmacist misinterpreted the dose, nursing didn't double check it, the PA wasn't involved in the situation. So in order to fix this, we want to establish a standard protocol to make a system of checks and balances for medication administration. And we also want to make sure at the beginning of every shift, we're holding meetings to emphasize the importance of pediatric supply availability and clarifying orders when pediatric patients are involved. And then we're also going to make sure that pediatric dosing guides are available to all of the providers, including pharmacists in the emergency department. So Casey, I think you're next.
Okay, so the issue on our side was just the staff response to the decrease in level of consciousness. Our main issue is obtaining that history on asking the mom whether or not if Jackson was given an unknown substance. It was kind of uncomfortable. And then we weren't sure if Jackson accidentally ingested something without her or her grandma knowing that. So that was difficult to determine. And as well as just the misunderstanding on Jackson's medical needs between mom and grandma. So what we want to do is just establish a standard protocol for monitoring patients in general, in Jackson's case, specifically with acute respiratory distress, that is a team-based approach involving multiple disciplines. We also want to make sure that we want to give a handout about the information in regards to their diagnosis, what that means, how it came about, symptoms, how to treat it, and then what to do with follow-up care, just so that they have a better understanding. We also want to incorporate some training for all staff on just better patient history taking on how to approach those uncomfortable questions so that will better the care that we provide. And we also want to make sure between us staff that we use callbacks, SBAR, and CUS just to enhance our communication. And then lastly, to verify all the information with the family members, we want to use callbacks to make sure that they understand fully what we're doing.
Sounds good.
Okay, so it's hard to think that this asthma attack wasn't preventable. So a couple reasons why we think that it could have been preventable was probably the fact that Jackson wasn't taking his meds, and that could be either due to mom or grandma not understanding that they need to be compliant, maybe not knowing how to administer them, or the fact that Jackson maybe just doesn't like his inhaler due to his autism. Also, the mom is a smoker, so this could have been exacerbated by secondhand smoke. Also, there could be a lack of communication between mom and grandma on if he's been taking his meds every day, whether or not he's getting them or if they're tracking them in general. So what we're going to do is we're going to give them a clear checklist and ensure that each member of the family, mom and grandma, and Jackson as well, knows if he's taking his meds today, therefore he never gets overdosed or underdosed. We'll provide them an action plan in terms of if he does have another exacerbation, then they'll know what to do, either give him other medicine or admit him into the hospital. Also, we can give him a peak flow meter that will allow him to monitor his breathing at home. Also, we'll need to ensure that we teach the mom and grandma about the symptoms of asthma exacerbations, and we'll use a teach-back method to ensure that they understand that. And need be, we can involve SLP and OT to help Jackson with his inhaler. Also, we will have the medical staff educate the mom on the importance of not smoking around her child, which could exacerbate his asthma as well. And finally, we can just ensure that Jackson will have the plan, like I said, the action plan, and make sure that both mom and grandma understand how to basically incorporate that into his everyday life.
Great. Thanks, Garrett. I'll kind of go off that a little bit. There was definitely a lack of communication between mom and grandma. Grandma had custody of Jackson, and then she wanted legal guardianship. So they had to reach out to mom. That triggered mom to want to obtain guardianship instead. So she felt grandma was babying him and didn't understand the importance of his asthma medication and things like that. So she had a misunderstanding of his medical needs because it wasn't communicated to her through grandma or anybody else. So she feels like she's going to be blamed for this hospital stay because she was unaware of the situations that were occurring. So ways we're going to try to fix this is for the hospital as a whole, we're going to establish a standard protocol for a social worker or case manager to be involved in every case where clear guardianship is not present. And in regards to Jackson's case specifically, medical staff will be involved in Jackson's care will explain the importance of good communication when it comes to his medications and treatments, especially if he's going to be going back and forth between grandma and mom. They need to both understand how to communicate with each other. And that's where I'm wanting to implement. I've talked with mom and grandma a little bit about starting therapy to improve their communication with each other for the betterment of Jackson's health and well-being.
Okay, great. So overall, I felt like, and as a team, we kind of felt like there was a general lack of knowledge about Jackson and his autism diagnosis and what's required for that. So first, the problems we noticed, the PA was unsure if the drop of Jackson's consciousness was due to autism or something else. And then staff in the case was unaware of magnesium toxicity side effects, and they were also unfamiliar with children with autism. So to address the situation of the lack of communication about autism, we are going to require a hospital-wide training related to autism. So characteristics of it, what it is, how children communicate with others, and how to best communicate with them. This is going to be offered 6 times a month, and staff is going to be required to attend one of those trainings for an hour. As far as magnesium toxicity side effects and kind of being generally unaware, we're going to implement a new protocol that medical staff involved in all cases must review the patient's case history form before going into the situation, and then initial at the bottom so that they understand and have read the entire case history.
Well, that sounds like a really good plan, guys. Anybody have any questions?
No, I think it's
Have a
good.
good day, and we'll get started on that.
Great.